opposite threads. These two threads from left should go to the opposite side between the opposite two threads. So, in and in between. Same here, in between and in between. That's it for the marking. So, please lay down here. I need your head at the end of the table. Could you be closer to me? More. Yes, that's good. Very good. Dear colleagues, position of the patient is very important during the procedure. As you can see, my patient is on horizontal position on the table. His head is at the end of the table, quite close to me. If I will put my hand on 90 degrees like this, можешь показать совсем сторон, чтобы вот подальше, туда. I will show you now on the camera, one moment. So if I will put my hand on 90 degrees like this, my fingers will be exactly near to the area where I'm going to work. So his face is not too far, not too high, not too low. And when I will work on the side, I will never move my body to the patient's face. What I will do, I will move patient head on the needed direction, and I will work comfortably during the procedure. So I will use only my fingers, and I will focus only on the procedure and not on my back pain, of course, during the procedure. My nurse will clean patient's face right now. Я сначала анестезию все лицо сделаю. Да. Покажи меня с той камерой, как я думаю. So, as we discussed it already today, aseptic rules during the thread procedure is a crucial part, because we are implanting foreign body material to the tissues of our patient. And we are touching this foreign body material, this thread, with our fingers. That's why we have to follow all aseptic rules during this procedure to avoid such complication as infection. Of course, infection is very real complication. I'm sure you will not meet with that complication in your practice. But to prevent this complication, we need to follow aseptic rules, and we need to do all these parts properly. So in vaccine, I'm washing my hands. My nurse already cleaned patient face using betadine. We love to use betadine. It is a great solution for the cleaning of the face because it has no alcohol inside, and it is also make a color of the skin, so you can check yourself where you already cleaned and where you did not clean yet. So we will prepare our patient now for the procedure, and we will begin in a minute with the local anesthesia. Even you are working on a side, on a part of the face, for example, you are doing only neck. You need to clean full face of your patient. You need to clean even nose, lips, because during the procedure you may touch some parts of the face with your sterile gloves. So it's better to be clean everywhere, and you are sure that you follow your aseptic rules well. Okay, we are ready with the local anesthetic. Move your head. lidocaine 2% with epinephrine, 3 cc syringe, one of the best syringe for the local anesthesia injection, 5 cc, 10 cc, difficult to control. First entry point here. Another 2 entry points here and here. Entry point for visage close to tragus. Entry point for light lift needle method behind the airlock. And here I am doing a little bit hydrodissection because I expect that it will be difficult to pass platysmo-auricular ligament. So I am doing a little bit more local anesthesia. Here, I just did a small drop. But here, I did it around. Then I will do exit turning points for the needles, where I will turn my needle to follow to the opposite side. First exit points for the needle technique will be on the straight line of the angle of the mouse. This is under the mental ligament somewhere, plus minus, of course. So this is the first exit point, and I will do around a little bit. And second exit point here. When I will come from opposite side, from the left to the right, and as soon as I will cross medial border, I will exit again. So here also I will prepare my exit points. Later on you will see these points, and I'm preparing these points right now with the look. 18 gauge needle. Working very gently, not damaging the tissues too much, so I'm not doing such movements. Of course not. And injecting now local anesthesia using cannula. Again, now I have 2.5 cc. There I use it about 1 cc for the entry points, 2.5 in this syringe. I'm adding local anesthesia. So one line here, second line here, and third line in the middle. That's it. Here we need 4 lines because we have 2 excellence visage threads, which will go, each will go 2 times. So it will be 4 lines. 1 line for 1 spring, another line for another. How are you? Good. And several lines for excellence visage. And we will finish this side. Just.
قانلوش نشکنه
tissues. I use it 2.5 cc for whole side, plus around 1 cc for entry point. So, yes, nasolabial fold we will do right now. So, for the threads, I wanted to show you separately for the threads the quantity of local anesthesia, because we don't need to feel tissues with the local anesthesia for the threads. Of course, sometimes we do hydrodissection. When my patient has a lot of scar tissue, when I'm expecting fibrose there, when I'm working on the forehead, for example, or, as I told you, I'm sure that I will have difficulty to move behind the airlock. So there, in some points, I will do some kind of hydrodissection, but of course, not all over the way. How are you? We need nasolabial fold right now.
Dear doctors, if you will have questions and you want Dr. Josh to hear you, please raise a hand and I will help you a microphone and it will be possible for him to hear you.
This is for the nasolabial fold. Iranian man is very brave, by the way. Look to him. strong. Here I have around 1 cc of local anesthesia. Quite strong dose.
همه نفتی میخواد برایش از 200 میلیون تومان نفتی خواهد بکنید.
So I use it about half cc for the longest one. It was 1 cc, I use it about half cc. I will give it a minute to relax, and we will do the opposite side. As we know, lidocaine works immediately, almost immediately after the injection. 2-3 minutes and patient don't feel pain. But adrenaline, which makes a vasoconstriction, needs a little bit longer time. And it needs about 7-10 minutes for the good vasoconstriction. That's why when we are doing local anesthesia, we do it step by step. We do one side local anesthesia, then we give patient time to relax a little bit, because it was painful, of course, and we need a little bit time. Then we do opposite side, same with the local anesthesia. Again, we give time patient to relax, and then we return to the right side back to do the thread implantation. All this will take about 10 minutes, more or less 7-10 minutes, and you will get a good vasoconstriction with your local anesthesia. How are you? Let's do opposite side. Very good. So let's do entry points everywhere.